Well, a big question since all this started is, should I be wearing a mask or do I not need to? That's something a lot of people have been wondering.
Yeah, for weeks, health officials have been recommending not to wear a mask if you are not sick, but now the CDC says it is reviewing that. Part of what is fueling that comes down to who is fueling the pandemic. There's more data indicating now that people who do not show symptoms are furthering the spread. Research in Iceland shows 50% of those who tested positive were asymptomatic. That meant they had no symptoms. In the U.S., the CDC is estimating about a quarter of the coronavirus carriers do not have symptoms. Channel 9's Joe Bruno is joining us live tonight. Joe, North Carolina officials, however, say you should really save those masks for medical workers. That's their position now?
The state is really stressing at this point the focus is on making sure medical providers have all of the masks that they need. But this comes as the CDC is reviewing recommendations on whether the public should wear masks out in public. A debate once downplayed is now resurfacing, whether the public should wear masks. The Surgeon General confirming on GMA that leaders are giving the guidance a second look.
There's a fair amount of asymptomatic spread. And so we've asked the CDC to take another look at whether or not having more people wear masks will prevent transmission of the disease to other people.
Dr. Mandy Cohen says the first priority has to be getting masks to our healthcare workers.
They're on the front lines treating sick folks with COVID-19, and we want to be protecting them.
Getting enough supplies has been easier said than done. Emergency management officials requested 500,000 N95 masks and procedure masks. In the first two shipments, the state only got 38% of the masks they requested.
We're scouring the world to make sure we have the supplies for our frontline healthcare workers and our first-line responders.
But in the future, when supply lines are better, Dr. Cohen says masks may be another element to tried and true ways to prevent the spread of COVID-19.
Masks are protecting the world from you. It's not really protecting you from the world.
The Surgeon General says if you do wear a mask out in public, it doesn't have to be one of the N95 ones. And if you do choose to wear one of those masks, you may be taking one away from a medical professional. Erica.
Yeah, Joe, I mean, this is something that no one has seen before, so we're all going to have to realize each day, each week, we're going to learn new information about how to combat it. Thank you.